Tuesday morning, that means a chance to catch up with Dr. Isaac Bogosh, infectious diseases specialist at Toronto General Hospital. Dr. Bogosh, we always appreciate the time. Let's start here this morning. Canada has approved a vaccine to prevent Ebola in non-pregnant and otherwise healthy adults aged 18 and older. We don't really hear a lot about Ebola here in Canada, so how significant is this?
It's important. We know that, of course, Ebola virus exists in African settings, but of course, there's been a couple of really big outbreaks of this infection in the last decade. We had the massive infection in West Africa in 2014. That lasted a couple of years, 30,000 people infected. Then we had another big outbreak actually during the time of COVID-19 with about 3,000 people infected. This is sadly going to happen time and time again. People travel. There's certainly the possibility for people to land in Canada. And of course, we have workers who might go and assist outbreaks in African settings. It's important to have access to this vaccine. Sure, we're not going to use it a ton, but it's important to have it because we might use it in certain instances.
Okay, because something you don't hear much about, but like you said, we know how viruses travel. We know we've experienced that with COVID, so that's important. And let's talk about COVID right now, Dr. Bogosh, because there's some new research and information that's helping doctors identify people who could suffer from long COVID. We know, according to a recent survey from the National Center for Health Statistics, I want to quote these numbers properly, the condition may have affected as many as 962,000 children and 17.9 million adults. So how important is this research, and how is this potentially going to help people or help identify people who could suffer from long COVID?
Yeah, it's really important to be able to identify people accurately, and it's also important to support those people who have this condition. COVID's not going away. I think we can always look at data coming from various sources and nitpick over what the true rate of this is, but no one would argue that it isn't here. It is, and it's going to continue to be an issue for an indefinite period of time. We need tools to better identify patients that are suffering from this, to prevent it, of course, and that's just taking steps to prevent COVID-19. And then lastly, to provide people with the support and care that they need such that they're not suffering from this condition. There's been a lot of research focused on this area. We're starting to see the benefits of that research now, but I think we're still a long way from where we need to be, unfortunately.
Okay, got about 40 seconds for this last one, Dr. Bogosh, and I noticed that you tweeted about inhaled glucocorticoids. I have no idea what those are, of course, but of course you're the expert here. I see they've been tested as a possible potential, early outpatient therapy to prevent the progression of the disease, the therapy here. So are they working? How promising are they?
No, unfortunately, that didn't work out. So during the dark days of the pandemic, when people were suffering from COVID-19, not sick enough to be in hospital, we would give them inhaled steroids. And there was some early data suggesting that this could alleviate, shorten the duration of symptoms. It doesn't look like that's the case. It doesn't look like they work. This was a well-conducted, randomized controlled trial published in the New England Journal of Medicine. Maybe it provides some symptomatic relief, which is always good, but it doesn't really shorten the duration of illness for people with COVID-19. Good to know.
All right, yeah, this is what research is all about, I suppose. Dr. Bogosh, I also always appreciate your work. Thanks for joining us. We'll see you back here next week. Have a good one.
You will. Thank you.